Hi, I'm Molly McDonnell, and I'm Fight CRC's Director of Advocacy. Fight CRC is the nation's leading colorectal cancer advocacy organization, and we've been working to give the colorectal cancer community a voice on Capitol Hill for over 15 years. We had a major victory late last year with the passing of the Removing Barriers to Colorectal Cancer Screening Act, and that was because of the power of advocacy. You did that. We are working to build on that success, and a key part of that is advocating for greater funding for colorectal cancer research and prevention. As we have for many years, we also continue to advocate for the National Institutes of Health, or NIH, and the National Cancer Institute, or NCI. The NIH leads breakthrough medical research in the US and around the world. This agency supports the foundational research that forms the building blocks for life-saving treatments and cures. It is made up of 27 institutes and centers, all focused on different conditions. The National Cancer Institute, or NCI, is one of those institutes. The NCI is the principal government agency responsible for cancer research in the United States and supports everything from basic research to clinical trials. The NCI is central to the development of better prevention methods and better treatment options for colorectal cancer. So this year, we're asking Congress for $46.111 billion for the National Institutes of Health and $7.609 billion for the National Cancer Institute. Wow, those are some crazy numbers. And so I know you might be wondering, how did we come up with them? Well, we work with our partners in the cancer community and beyond to make sure that the NIH and NCI have enough money to both continue and expand the important work that they're doing. By getting on the same page and locking arms with the broader patient community, we strengthen our voice on Capitol Hill. So why is this important? Well, research takes both time and resources. Both the NIH and the NCI need increased and predictable funding to continue to develop better treatments and eventually a cure for colorectal cancer. And unfortunately, research funding for colorectal cancer has not had consistent increases over the past several years. So we need to make sure that the NCI continues to make colorectal cancer a priority. So what do all those numbers and letters mean in real life? Well, we've brought in Dr. Erin Van Blerigen, an epidemiologist at the University of California, San Francisco, and an NCI grant recipient. She's going to share with us a little bit about how the NCI supported her research on how nutrition and physical activity impact cancer survivorship.
So the National Cancer Institute has really made our work possible. I started my career with a career development award from the NCI, which was really allowed me to focus on colorectal cancer, specifically looking at kind of observational studies, which are looking at people's self-reported behavior for nutrition and physical activity and survival. And we learned that there was a very strong association. So people who had healthier habits had a 42% lower risk of mortality. And so that work also in the Career Development Award provided me with the training I needed to really lead my own research program and go on to apply for more grants from the National Cancer Institute. So now we're doing a project also funded by the NCI called Tools to Be Fit, where we're trying to figure out the best way to help colorectal cancer survivors kind of learn about and follow the national recommendations for diet and exercise after a cancer diagnosis. And this study is really, it's entirely supported by the NCI, and we're working to really just kind of figure out what works best and for who to make lifestyle changes. Our goal is to build resources and tools to understand what the best way is that we can help support cancer survivors after they've been diagnosed and empower them to improve their own health and outcomes. And so, the long-term vision is that this would be a program maybe similar to cardiovascular rehab, something reimbursable by insurance that was just part of your survivorship care package to really give everyone the tools they need to be as healthy as possible. I really can't overstate the importance of the NCI funding for our research on behavioral risk factors in cancer. It's the backbone of both my career and all my colleagues for the funding that we receive to support our salaries and all the research and research expenses that we do. There are really not that many other options for for science focused on, kind of non-therapeutic interventions and support. And so, there's like some limited options in terms of foundation and philanthropy. But the NCI is really kind of the provides the foundation for all of our research.
Lives are at stake. We need better treatment options. So once again, we're asking Congress to provide $46.111 billion for the National Institutes of Health and $7.609 billion for the National Cancer Institute to continue to expand and grow colorectal cancer research. Be sure to check out our advocacy portal at fightcrc.org/advocacy for more information and resources on all of our policy priorities.